Hi, I'm Dr. Adam Lipson. I'm one of the neurosurgeons and partners here at IGEA Brain and Spine, servicing New York and New Jersey.
And I'm Dr. Ciro Randazzo, also a neurosurgeon and partner at IGEA Brain and Spine.
So Ciro, we're going to talk about something that's commonly discussed in the media and what we all deal with as neurosurgeons, which is concussions. You have kids, we see this in sports all the time. Maybe we could just start with maybe defining what's a concussion, how do we navigate this medically?
Yeah, a concussion oftentimes occurs when someone has an injury to their head, and they don't even necessarily have to strike their head, or striking your head doesn't have to be evident. But what's really the defining characteristic of a concussion is a change in the level of consciousness. You don't have to pass out. In the past, we used to say, if you passed out, you definitely had a concussion. That's not the case. It's really an alteration or a change in that level of what we call arousal, how awake someone is.
Right, yeah. So when someone has any sort of trauma and they look a little stunned, by definition, that's already a concussion.
Correct.
And, we commonly see this in dealing with head injury, which is a much more serious condition. But with the concussions, maybe we talk a little bit about how do you work it up?
Yeah,
what do you talk to the families about
I
it?
think the most important thing is to prevent a second concussion.
Yeah.
So that even if there's a concern that there's a concussion, that person should be immediately removed from any possibility of suffering a second one until it can be evaluated by a full medical professional. Removal from play, removal from, better to err on the side of caution than to have a second injury, which could be devastating and life-ending.
Right, and it's those repeated blows that really have more functional consequences downstream. I think when someone has a true loss of consciousness, they probably should be going to the emergency room, getting some sort of imaging study of their head. But a lot of times we're dealing with the sequela or the downstream events. Kids in school, they're having trouble focusing, some moodiness, some memory issues, and those are things that we really recommend following. Most schools have these impact testing programs now or other programs.
Yeah, so they can test you at baseline and see if there's a change over time after an injury, and that will really help guide return to play, because that's one of the big concerns now. And that's also evolving. The treatment of concussion is evolving, when to get patients back to playing and back to full levels of activity.
Right, and I think that there's been much leadership from NFL and the armed forces in dealing with this major concussion issue. Obviously, they're dealing with often higher forces and continued repeated blows in a professional context. But I think that it's fascinating just seeing how much research and how much of an interaction with the medical community and these professional communities there is in trying to improve the state of concussion care.
Yeah. And I think there's not a lot more concussions happening, but we're looking for them more actively, and that's why it seems that they're happening more and more often, because we're looking for them, we're diagnosing them more often, and we're treating them more often than we had.
Right, and I think the thing we want to emphasize is that patients really should come to the physician, seek an expert opinion if they're dealing with these issues.
Right.